Hi everyone, we might get started. So thank you so much for joining us today for this really interesting topic. I'm Jessica Stewart, Executive Director of the Family and Community Services Insights Analysis and Research Directorate, also known as FACSIAR in the Department of Communities and Justice. And welcome to this month's Lunch and Learn Research Seminar on how investing in human services improves outcomes and makes economic sense, the New South Wales Investment Approach and Forecasting Future Outcomes Model. So before we begin, I'd like to acknowledge that wherever we're joining today, we are living and working on Aboriginal land that was never ceded. I'd like to personally acknowledge the Bidjigal people, who are the owners and First Nations people of the area in which I'm joining in today. I'd also like to pay my respects to elders past, present and emerging, and extend that to all of our Aboriginal and Torres Strait Islander colleagues joining us today. I'd also like to warmly welcome all of you. We've had a fantastic response to this webinar with more than 500 people registered. Really just goes to show the interest and importance of this topic. So in today's FACSIAR Lunch and Learn, we have some fantastic presenters from New South Wales Government Actuary, which is a team that works on behalf of New South Wales Government as a whole and sits in FACSIAR, and they'll present the work that began under the Their Futures Matter reform in 2018. And the work really aimed to build much needed data and evidence to drive improvements in family support programs and better support families before they hit crisis point. The vision for Their Futures Matter is now embodied in the Investment Plan for Human Services in New South Wales, and that's a plan that was released in late 2023, which outlines how New South Wales Government is working to take an investment approach to supporting families. By investing earlier, we get better outcomes and reduce costs to government, which can be reinvested to support more families. So today we're going to cover the main component of the New South Wales Investment Approach, which is a forecasting future outcomes model. So this model uses service usage data, so services that people receive, and life outcomes information from a large number of New South Wales and Commonwealth government agencies, as well as evaluation results, so that we can better understand what services people receive across New South Wales, understand the factors that affect people's use of human services, project their likely service use into the future, and then really build the evidence of what works to improve outcomes for people across New South Wales and reduce costs. So at this time, I would like to introduce our presenters. So Alex Coburn. Alex has been with FACSIAR since 2014 and is the Manager of Investment Modelling. Alex is an Associate of the Institute of Actuaries of Australia, and his prior professional experience spans both public and private sectors. During his time with FACSIAR, he's managed and contributed to the development of models and reports such as the NEED model, the analysis of intergenerational child protection issues, the social housing policy model, and the child protection investment model. So welcome, Alex. Hannah Kenyon. So Hannah is a Senior Investment Modelling Analyst with FACSIAR. She has spent the last 3 years working with the Forecasting Future Outcomes Model. Prior to this, Hannah worked on the Child Protection Investment Model and the Housing and Homelessness Investment Model. Hannah's background is in the actuarial sciences, and she is an Associate of the Actuaries Institute of Australia. Welcome, Hannah. And Ramanan Sornaraja is an Investment Modelling Analyst with FACSIAR. Rama joined the Economics and Evaluation team in 2019. Before that, he was an analyst in the Macroeconomic Statistics Division of the Australian Bureau of Statistics. And prior to working on the Forecasting Future Outcomes model, his work involved managing the supply model, which is one of FACSIAR's first internally linked longitudinal data sets. So welcome. So after the presentation, we'll have some Q&A. So for everyone that has joined us today, please put any questions you have from our presenters in the chat box, and we'll come to those at the end if we have time. Just to let you all know, the session is being recorded and posted to our FACSIAR webpage as we do each month. And anyone that's registered for today will receive the link to that recording so that you can share it with interested colleagues. So thank you so much, and please go ahead, Alex.
Thank you, Jess. Yeah, I appreciate that introduction, and thanks to everyone for coming today. So just to start out with, I'd really like to say it's an incredible privilege to present to you all. And the work of the New South Wales Government Actuary really has evolved for a number of years now, and it is really an absolute pleasure to present from where we, since the inception of the New South Wales Investment Approach. So just to go through the contents of today, I'll be starting off with providing a brief history of the investment approach and how it came to be, as well as an overview of the investment approach itself, and then of the forecasting future outcomes model. And then my colleague Hannah will take you through basically a demonstration of the analysis that we can use to help understand groups of vulnerable people in New South Wales and their service use. And then Rama will look at a case study demonstration as well of how we calculate the expected return on investment. And then hopefully at the end, we'll have some time for questions. So just a brief history. In 2015, the Tune review into the out-of-home care system in New South Wales was commissioned, and that made a number of recommendations. It aimed essentially to create a service system that delivered a coordinated wraparound and evidence-based support services or programs to improve the lives of vulnerable children and their families in New South Wales. And the idea is to improve the effectiveness of the programs and so that there's more money available, or that the money available can go further, I should say, and can be reinvested so that we can ultimately help and empower more people who are in need in the community. And so those recommendations that the Tune review made was that the approach should be outcomes focused. It should have strategies that are evidence-based. There should be collaboration between government agencies. It should use data to inform decision-making. And it should aim at an efficient system that improves outcomes for the community and is accountable. That's really, really essential. So the investment approach to human services in New South Wales was one of the New South Wales government's responses to those recommendations. So since 2015, a lot of work has ensued. Starting with really the development of the human services data set, which is a large multi-agency data set. So that's the collaboration between, or part of the collaboration between agencies. And I'll go into reasons sort of why that is, why we need a cross-agency data set a bit later. But then looking as well, following from that was in 2017, the first version of the forecasting future outcomes model was developed and built based on human services data set. In 2018, a report was published, which really demonstrates stage one of the investment approach analysis cycle, which I will get to later in this presentation. And after that, a second version of the forecasting future outcomes model, which was really an enhancement to the original model. It was based on an updated human services data set to June 2019 at the time. And that also included a linkage to Commonwealth data as well. And I'll explain a little bit more about that later. And then we published another report in 2022, which demonstrated how the expected return on investment is calculated. And that's part of stage 3, which I'll talk about later as well. Also in 2022-23 financial year, a report titled An Investment Plan for Human Services in New South Wales was published alongside the 2022 report. And that should be available on the website. I think the links have been provided here. If you want to access those today, you can. Okay, so just an overview of the New South Wales investment approach. Essentially, the New South Wales Investment Approach aligns program effectiveness with financial benefits. It is based on really the understanding that need for services is aligned with service use, and service use is aligned with cost. So if people's lives improve, then they're expected to not need as many services in the future. And since programs are designed to improve people's lives, then if we can measure program outcomes or how effective they are, then we should be able to estimate by how much, on average, people will reduce their future service use, and therefore their costs that can be avoided as well, the cost to the government or the community of providing those services. So to do this, we need an actuarial projection model, like the forecasting future outcomes model, to project the future service use at a baseline, which is, kind of a business as usual scenario, or a scenario without any programs or investments, just under normal conditions. And then we run a similar projection, and then as a scenario, but then that would be with the investment or with the outcomes expected from the program based on the evaluation. And then when we take the difference, we get an expected avoided cost and return on investment. And that essentially means that we should be able to assess which programs are, most effective and allocate resources towards the greatest impact. And it also means that government or taxpayer dollars can go further, and hopefully we can help more people, and in that way we're being accountable. So hopefully this diagram provides a visual representation to explain things in a different way. So if you can see the upper curve here, so that really represents the projected future services without the program or under the baseline scenario. And then the lower curve represents the future services projected under the program or the investment. So because people with improved lives and improved outcomes are likely to use less services, as I've said, then they're expected to use less service, and that's why, in theory at least, the curve comes under. And then the shaded area in between represents the avoided cost. So yeah, that can be then compared to cost of program delivery, and they're really the main inputs to the calculation of return on investment. So the investment approach implementation effectively has 5 stages of analysis. And look, ultimately any of these stages of work can happen at any time, but depicting it this way highlights the cyclical and iterative nature of continually improving the work and programs and implementation, which includes data collection, evaluation, monitoring, and the analysis and review through these various stages. And effectively, an investment approach really can be applied during, the commissioning of new programs when new investments are made, or during the recommissioning of existing programs, or when existing programs perhaps reach the end of their committed funding period, or even during a collaborative commissioning, when district commissioning agencies are working together collaboratively with program areas to identify opportunities. So looking at stage 1, this is really around identifying the need that exists in the community, or a need that exists in the community where there might be an opportunity to make a difference to people's lives. And we can identify perhaps a group of people or a cohort that may have a specific or common set of needs. So we ask certain questions like, what sorts of experiences are those people having, what sort of services have they been using and when, and what characteristics might they have as well. So that's identifying the need. And then in stage 2, it's really around designing the program to help those people, keeping in mind that, we already have a number of programs that are already underway. So the bulk of our work at the moment is really focusing on still stage 3 and 4 and 5 at the moment. So looking at stage 3, that's to estimate an ex-ante return on investment. And ex-ante really just means, at first sight or ahead of time. So we produce an expected return on investment that we might see, ahead of time, before really the program is underway. And that can be useful as an input to perhaps a business case in those early stages of program development prior to implementation. And so stage 4 really is around once, the program has been up and running for a while, it's about measuring the realised outcomes with an evaluation of the program to look at and the outcomes that result from the program, how the program is improving lives, and obviously that depends on data, collecting program data, and an evaluation might be conducted by an external team of academics, or we may do that, internally using our standardized evaluation analysis, which is not actually the topic for today's presentation, but that will be potentially a topic for another presentation in the future. And when we measure outcomes, we might be looking at things like outcomes such as out-of-home care entries, or reduction in ROSH or concern reports, or reductions in or changes in justice interactions, things like that. So then stage 5 is really about computing that average expected avoided cost, as I've explained before, and comparing that to the average cost of delivering the program, and then computing the expected return on investment, and being able to do that across a number of programs allows us to then compare where program effectiveness actually lies for the purposes of reinvesting capital where it's potentially most effective. So looking at the components of data and evidence that support the investment approach, firstly, we have, as I've said before, a unit record longitudinal data set and a model to help project future service use and cost. And that's really, the human services data set, the linked cross-agency longitudinal data set, and as well the forecasting future outcomes model itself. As well, we rely on evaluations that measure the outcomes, of course, and then also we have program data, which I think I've already mentioned, collecting, which is collected during program operations, and that essentially tells us, who receives which program and when, and how much of the program did they receive, to what extent, and so forth. And then finally, we have, analysis of the results of the model that we do to assess the impact on outcomes and on costs, and so that we can compare the results across programs in a way that is a kind of standardized way, in the hope that we can reallocate that funding to where it works best, and obviously help more people. So looking at the forecasting future outcomes model, so the components of the model itself is starting with the human services data set, and at the moment we've linked that to Commonwealth data as well. That's that multi-agency longitudinal data set of service use history. At the moment, that's a cohort of people under the age of 25 and their families as well, and it contains demographics as well as service use and outcomes that we can gain from the data available, and that's essentially government administration data that we use. And once we've checked it, then it forms the basis of that population, what we call the population spine, and that's really the backbone of the model. And then, so once we've done that, we've cleaned that, make sure that that's appropriate, then we use the past service history to calibrate outcome sub-models. And that's kind of an extensive process that, statistical modeling, and they're the models that really allow us to project in a probabilistic way the future service use. And so we have a projection model, which is a Monte Carlo simulation approach for any of the nerds in here. But that really just means that, it's many simulations for each person that's in the data into the future, so that we can look at the sort of the averages, and we can see some of that variation in the model as well. And then we also have average unit costs, which are attached to those future services, and they kind of get discounted back as well. And then we have evaluation results, which I've mentioned, and they can be done externally or by the internal Stephen approach. And we use those evaluation results to define scenarios for each program. And then, like I've said, we've got tools and templates that we've designed. We also rely on the data lab environment from the Australian Bureau of Statistics. So moving on, what's included in the New South Wales Human Services dataset? Well, effectively, this is kind of coming back to, the need in the community. So people who tend to use social services tend to access a lot of different government services, or use a lot of different government services. And so in the past, a lot of those data sets were collected across in separate domains by separate agencies, because, I guess, with the inception of government, different agencies were originally set up to do different jobs, different tasks, play different roles, provide different services. And then this is really about bringing that all together so that we can have a holistic view of the services that people are using, and it really shows the extent of their need. So we have things like, child protection, justice, police services, housing, education, health, and the like. And we also, as you can see there, we've got the Commonwealth services, which represents the income support from Centrelink or Medicare benefits or pharmaceutical benefits that people might be receiving. So looking just at the flow of the data through the model, effectively we start with, the linked data set. We clean that. That's in the forecasting future outcomes model, and alongside that, that also feeds into the standardized evaluation analysis, and it can be used for evaluation if we need that alongside the program data. So that program data is also an input there, and then that comes up and we can see that the evaluation, we project the future services at baseline, and then we project future service use with the scenarios from the evaluations as well, and then we compare those scenarios to then calculate the expected avoided cost. And the expected avoided cost can be compared, as I've said, to the cost of program delivery to calculate the net savings, and then as well the expected return on investment, which enables us to compare programs and reallocate to where the greatest need or where the most effectiveness is for the greatest impact and to meet more people, hopefully. So looking at the forecasting future outcomes model and the role that it plays in the cycle. So effectively, we can use it during stage 1, stage 3, and stage 5. So either of these points in the cycle is really where the forecasting future outcomes model comes into play. So, and then obviously, yeah, I've mentioned the standardized evaluation analysis. That's really a that's applicable to stage 4. And alternatively, like I've said, we can use evaluations done by external organisations, external academics, and the like. But the standardised evaluation analysis is really a topic for a different presentation. But I just thought it's worth calling that out here because it is a very significant piece of work that is a massive input into the investment approach as well. So I'll pass on to my colleague Hannah, who will demonstrate some understanding for vulnerable people in New South Wales and how we do that, which is stage 1.
Great, thanks Alex. So I'll be talking through some of the population level results from the Forecasting Future Outcomes report. So the FFO model includes all New South Wales residents who are aged under 25 on the 30th of June 2019. And this includes those who were born in New South Wales, as well as those who've migrated to New South Wales at some point. So this whole of population group is forecast to cost the New South Wales and Commonwealth governments $191 billion for services that they're expected to use up until age 40. And this equates to an average estimated future cost of around $61,000 per person. So in total, across the whole study population, Commonwealth government costs make up 62% of projected costs. So this includes income support or Centrelink, shown in the yellow bar, Medicare, which is in the light blue, and pharmaceutical benefit scheme costs, which is in the pale pink. The remaining 38% of costs relate to services which are funded by the New South Wales government. So healthcare accounts for 15% of total projected costs, and justice costs account for another 10%, and these two are shown in the orange and the purple bars. So child protection costs, shown in the darker blue bar, account for 5% of total projected costs. So I just wanted to pause here briefly just to mention that we talk a lot about costs, and that's mainly because they are easily measured. However, we use cost as a proxy for service usage. So with lower service usage translating to lower costs. So I mentioned earlier that the average cost per person is $61,000, but this varies significantly for different cohorts within the study population. So as an example, the average cost for males is $48,000, while for females it's $75,000. Looking at this chart, we can see in the bar on the left that females tend to have higher income support, health and Medicare costs, which is shown in the yellow, orange and pale blue bars. And these costs are likely related to service usage associated with pregnancy, childbirth, and child rearing. In addition, the model includes intergenerational out-of-home care costs for children of the study population, which is attributed to mothers. And this also contributes to the higher average cost for females, and this is shown in the black bar. So while males have a smaller overall average cost than females, they do have a significantly higher average justice cost, which you can see in the purple section of the middle bar. One important feature of the FFO model is the ability to study the distribution of costs and service usage across the study population at a granular level. The grey curved line on this chart shows the total cumulative cost if we rank the people in the study population from highest to lowest projected future cost, with the highest on the left and the lowest on the right. We can see that there is a concentration of service usage and costs in relatively small proportions of the population, with 5% of the study population making up 25% of the total projected costs, which is shown by the pale blue line. The dark blue line shows that 19% of the study population make up 50% of costs, and the orange line shows that 48% of the study population make up 75% of projected costs. We can also look at concentrations of service usage for selected service domains. So we have 1% of people accounting for 28% of future justice services, 1% of people accounting for 48% of future child protection services for children aged under 5, and 5% of females accounting for 80% of next generation out-of-home care services. We can also consider the impact of education outcomes, which isn't illustrated on the slide, but of the children in the lowest Year 3 NAPLAN band, which indicates that the child is below the national minimum standard. Only 48% are expected to complete their HSE. And this compares with 86% of the children who are in the highest Year 3 NAPLAN band. So if we split out the chart that we saw previously by each of the service domains, we can see that some types of services are accessed by a higher share of the population, while others are accessed by a more concentrated group. So the grey dashed line here corresponds with the grey line in the chart a couple of slides back. And the services which are below this grey line are more universal and tend to be used by many people in the population. So we have Medicare in the pale blue at the bottom. The pale pink line relates to pharmaceutical benefit scheme costs, and the orange line is health-related costs. The services which are accessed by a smaller group of people within the population are shown by the curves which are a lot higher than the grey dash line. So we have child protection costs shown in the dark blue line at the top. Next generation out-of-home care is shown by the magenta coloured line. The teal coloured line relates to housing costs, and the purple line shows justice costs. Focusing on the 5% of people closest to the left of these curves, we can see that they're expected to use 92% of child protection services, 86% of next generation out-of-home care services, and 65% of housing services. This highlights that the New South Wales Government could potentially target investments towards a small number of clients that could bring about improvements in outcomes to those people. This could also result in a reduction in future costs to government, freeing up funds to provide support to other people. So this next chart shows the spread of costs across different service domains by percentile groups. So the bar on the very left relates to those who are in the highest cost percentile, or the top 1% of costs. The next two bars show the average cost for those in the top 5% and top 10% of costs. And the bar on the right side shows the average costs for those at the 50th percentile, or the median, which represents a typical average cost for the whole study population. We can see that those in the top 1% have an average cost of $586,000, which compares to $41,000 for those at the 50th percentile. We can also see that those in the top 1% have significant projected costs and service needs relating to income support, health, justice, child protection, and next generation out-of-home care, indicating an intersection of complex needs and the potential for future intergenerational impacts. These are the service domains where intervention can have the most significant impact in terms of improvements to life outcomes. So to try to better understand more about these people with complex needs, the Forecasting Future Outcomes 2018 Insights Report, written by consultants Taylor Fry, identified a number of vulnerable groups. These were an initial attempt to identify groups within the population for whom new support systems could be designed and implemented. The 6 vulnerable groups that were identified are vulnerable young children aged 0 to 5, vulnerable young adolescents, vulnerable young people transitioning to adulthood, young mothers and their children, children and young people affected by mental illness, and the 1,000 individuals with the highest estimated service cost. The definition of each of the vulnerable groups is quite detailed, so if you'd like more information on this, please have a look at the 2018 Insights Report. The projected outcomes of each of the vulnerable groups were compared to those for a group of randomly selected individuals with the same number and distribution by age, gender, Indigenous status, and socioeconomic status. And we can see here some examples of how much more likely individuals in these vulnerable groups are to have certain outcomes relative to their comparison groups. So individuals in these vulnerable groups are significantly more likely to have an out-of-home care placement. Their children are also significantly more likely to be in out-of-home care. They are more likely to be in custody, more likely to live in social housing as adults, significantly less likely to complete their HSC, are more likely to be admitted to hospital for issues related to alcohol and other drugs, and are more likely to require income support. So individuals can, of course, be in more than one vulnerable group, and there are lots of overlaps between the 6 groups. This slide shows the main overlaps. One thing that overlaps tells us is that within each vulnerable group, there is a broad range of vulnerability, which also implies that there is a range in the level of needs and support required. So the estimated future average cost for people in the vulnerable groups are, of course, significantly higher than that for the typical person. On this slide, please don't pay attention to the actual dollar figures as they're from the 2018 Insights report and aren't equivalent to the figures that I quoted earlier. But the relativities shown on the far left are more important. So we can see that individuals in the vulnerable groups have estimated future costs ranging from 1.7 times through to 16 times the estimated future cost of the average person. The model also allows for parental risk factors, as we recognise that changes to the parent situations can profoundly affect the pathways of their children. The 4 charts on the left side show the relationship between certain risk factors of the parent and their child's average estimated future cost of services. Each chart shows for children aged 0 to 5 the average estimated future cost of services for those whose parents have a particular risk factor relative to the cost of those whose parents do not have that risk factor. It's clear that children whose parents have these risk factors have significantly higher estimated future costs, implying greater service need. The model also allows analysis of the characteristics of women who are more likely to have children who require out-of-home care. The 4 charts on the right show the average cost of out-of-home care for the children of women with certain risk factors relative to the cost of those without those risk factors. Again, it's clear that there's a relationship between these risk factors and estimated future costs and service need. Using the model, we can also see how service usage and costs are projected to vary over the lifetime of individuals in each of the vulnerable groups. The charts shown here relate to a typical child in the group vulnerable young children aged 0 to 5, and they show how service usage trajectories of this typical child are projected to differ by age from an equivalent child in the comparison group. We can see that there is a much bigger difference in the projected costs for the vulnerable group versus the comparison group for justice and child protection, shown in the purple and blue charts, compared to income support, shown in the yellow chart, indicating where the largest drivers of the difference in service usage and cost lie. We can also see which ages are expected to have higher future cost. For example, the sharp drop in justice costs at around age 18 is explained by a higher unit cost for juveniles in custody than adults in custody. So I'll now hand over to my colleague Rama, who'll be talking through the application of the FFO model to a family preservation program.
Thank you, Hannah. Hello, everyone. This is the part where I run through an application of the Forecasting Future Outcomes model, demonstrating stage 3 of the analysis cycle. It is a real privilege for me to have had the opportunity to work on this model. I used to wonder how research papers or evaluations put a dollar value on the benefits that a government program would bring to wider society. I'm really happy that I've had the opportunity to work on a model that does this for programs that benefit the New South Wales community. I will talk through how this is done using Functional Family Therapy Child Welfare Program, which I will refer to as FFT. This slide shows a brief overview of what I will be running through. The first step is defining a target group or people eligible for the FFT program. A projection is run for this target group to find its expected future outcomes and the associated projected future costs. This target group projection is known as the baseline. Scenarios are then defined based on potential outcomes that the FFT program can bring about. These scenarios are applied to the target group and fed into the model to calculate the projected outcomes and costs that would occur if the target group received treatment from functional family therapy. By comparing the baseline and scenario results from the model, we can put a dollar value on the benefits of the program. This is essentially an avoided cost as a result of improved future outcomes for our clients, which in turn leads to a reduction in government service need. To start off, here is a brief introduction of FFT. Functional family therapy is a government program that was introduced into New South Wales fairly recently. The program involves therapy sessions with the child and, more importantly, the child's family network. Its main focus is to help prevent children from entering out-of-home care. Now, out-of-home care is a necessary function of the state to keep children and young people out of harm's way. However, we know from other analysis that being in out-of-home care can lead to disadvantage, not only for the client, but for the client's offspring. For this analysis, we will be focusing on the outcome of the child, as FFT is a child protection program. The first step in our analysis is to understand the clients that are likely to receive functional family therapy. This is what we refer to as the target group. The target group is defined for use in the model by looking at the program logic or program eligibility criteria and applying it to the human services dataset. Not every eligibility criterion is able to be applied to the human services dataset because not all criteria have associated variables available in the data. For example, FFT is not appropriate for a child or young person who displays suicidal ideation. This is because they would probably require a different type of service. The human services dataset does not have a variable indicating suicidal ideation, so we are unable to identify a cohort based on this criterion. The following charts give a profile of the demographic characteristics of the FFT target group. We can get an idea of the target group's age and other characteristics. By running the projection for this target group, we get an understanding of the baseline expected future outcomes. We have the non-target group as a comparator, which acts as a cohort who are unlikely to require FFT. Even though the FFT program focuses on child protection, you can see that the FFT target group is more likely than the non-target group to require services in other domains, such as housing and justice. As a result of the impact of the program, we would expect that improving people's lives through better future outcomes reduces the client's need for services across multiple service domains. Now, this is the only point in the analysis where we consider the outcomes of the non-target group. The rest of the analysis only applies to the target group. So how do we calculate the impacts of functional family therapy? We use scenarios. The model has a number of levers that can be pulled to show potential impacts of government programs. However, those levers are constrained by the variables we have access to in the human services datasets. We therefore have to define scenarios that can be applied to the model. We have the ability to run multiple scenarios through the model. This can help us explore areas in which the program may have impacts, and this in turn helps us to show a range of potential outcomes that can be improved for the client. An improvement of outcome results in less service need by the client, and this in turn can be translated to avoided costs. As I have said, our scenarios mainly use outcome results from evaluations. For functional family therapy, we relied on an evaluation run by the National Drug and Alcohol Research Center, also known as NDAC. We were able to apply the impact of FFT in reducing a client's chance of being subject to a risk of significant harm report or entering out-of-home care. Although the NDOC evaluation did not evaluate the impact of FFT on parental risk factors, we have included a reduction of parental risk factors in our scenarios because FFT is a therapeutic program that actively involves parents. Another aspect of using scenarios in the model is the ability to extend the time period of impacts of a program. The NDOC evaluation measured outcomes of the FFT program over a short period of time. The forecasting future outcomes model has the flexibility to extend the duration of those impacts. In this case, we have extended the impact to 10 quarters, drawing on research that similar programs show lasting impacts on participants. The second scenario highlights the versatility of the model in exploring benefits to clients that may not be measured by an evaluation run in an Australian setting. A 2007 evaluation run by the Justice Research Centre in the United States reported reductions in recidivism rates among youths who participated in FFT. Extrapolating this to an Australian setting, we have been able to project a list of results that involve the same inputs into the projection as scenario 1, along with a reduction to the client's group's justice interactions. This table shows us the results of 3 projections applied to the target group for FFT. The baseline refers to the target group if it had no FFT intervention at all, along with results for the target group under the conditions defined in the 2 scenarios. You can see from columns 2 and 3 that the total estimated future costs are less than the baseline. The results we focus on are the 4th and 5th columns in the table that show the difference of the impact of FFT relative to the baseline. They show the estimated impacts on the need for services and therefore avoided costs resulting from the reduction of rush reports, out-of-home care, and justice interactions. Scenario 2, which includes the impact of scenario 1, but explores the possibility that FFT has an effect on justice interactions, shows an increase for avoided costs to the justice domain in column 5 when compared to column 4. This table shows our expected return on investment calculations based on the avoided costs found on the previous slide. The table shows total expected future costs and the avoided costs of scenario 1 and 2 when compared to the baseline. It also shows the investment by the government in delivering FFT. We divide the projected net savings by the investment per person of $8,500 to get the expected return on investment. This tells us the return in projected net savings that FFT is likely to generate for every dollar invested in FFT. The final slide shows the range of expected return of investment plotted on a single graph for scenario 1 and scenario 2. At the time this analysis was conducted, we estimated that the New South Wales government's then existing investment in FFT would not only cover its costs, but lead to projected net savings of between $11 and $15 million. I will now hand it over to Alex to wrap up.
Thanks, Rama. Okay, awesome. So yeah, just wrapping up. As you can see, hopefully from the presentation, that we're really sort of forging new ground here. We're in a place that the New South Wales government really hasn't been before, because we can now quantify the performance of human services programs in terms of not only their impact on people's lives, but also on costs to government, which are generally aligned. But yeah, so that's essentially where we are. I think it would be appropriate for a future presentation on the Stephen approach, the standardized valuation approach, which is representing stage 4 of the investment approach. And yeah, so maybe we should move on and see if there's any more time for questions. We've got about 10 minutes. So if you have a
Thanks.
yeah.
Thanks so much, Alex. Sorry, my camera isn't working. Thanks so much, Alex, and that was a really terrific presentation. Do people have any further questions? I can see there's been a few comments in the chat which we've responded to. Actually, there's one here from Adam Alex. So the same program might have different results in different places due to the way it's implemented, involvement of community, quality of service, etc. To what extent are we able to understand the impact of the how as well as the what of programs and services?
So if I'm reading this correctly, is it, yeah, involving the community, sure. Absolutely. We, at the moment, we're not sort of drilling down to the location level, although I'm not ruling out that that couldn't be done. You know, and if, you know, there's lots of different dimensions to quality of service and cultural relevance as well. I think at the moment, because the investment approach is sort of in its kind of in its, I wouldn't say it's infancy, but it's really just still getting off the ground. We're focusing on programs, you know, that are existing overall. But if we wanted to sort of drill down to that location level, then there's no reason why we couldn't. We do have some geographic information fields in the HSDS, so that should be possible, yes.
Thanks, Alex. There's also a question here. Just wondering if there's been any sibling analysis conducted to see if their trajectories differ.
No, we haven't done anything like that yet. Sort of the detail that we've been trying to tease out, like if you look at the 2022 report, we did a demonstration on actually a UK program because, and in that we've teased out sort of cost or service uses for the parents as well as the children. We haven't yet separated siblings yet. Really, it just comes down to at the moment, because of the way we're defining cohorts, we're defining them sort of as Rama had sort of demonstrated, we're defining them based on eligibility criteria. And in that way, I guess the projections are a little bit more, they're probably not as accurate or probably not as specific, I should say, is the right word. Yeah.
Thanks, Alex. There's also a question about updating the model with 2021 data.
So yes, our next, well, actually I have a slide on that. So I have a slide really on next steps, kind of in case that was going to be asked. And yeah, I mean, really, this probably should have been part of the presentation anyway, but yeah, so our plan is underway. We're already working with the ABS, to the Australian Bureau of Statistics, to link the 2022 human services data set with the PLIDA, and you know, so that work's underway. So we're effectively, we're kind of, you know, the first data set linkage was 17, then it was 19, now it's 22. So, you know, we'd like to be able to do it every year, but it's just the resourcing and the time involved just isn't really feasible to do that. But yeah, we're already ahead of you to get to 2022. Thanks, Amity. I appreciate that question. Chris, I think you had a question about the unit costs. Those unit costs mainly come from the costing manual. So that's in Colleen Lombardo's domain. So you can potentially reach out to Colleen. we are a recipient of the unit cost manual. We don't calculate them ourselves.
And there's also a question around fidelity, whether we measure that in the fidelity of programs.
Fidelity in what sense? Where's that question come from?
It's talking about, so when you deliver a service that has a program like MST or FFT that has program fidelity, are we able to assess fidelity to those models? So, I mean, yeah, I can help answer that. We do collect it. It really depends on the program. We do collect data, say for MST and FFT, we have quite good quality data around fidelity. For other programs, less so. So it really depends on what data is collected and what ends up in the human services data set, which is the base underlying data set for this. And absolutely possible to link future data that's collected to future refreshes of the HSTS.
That's right. I think I might jump in here with a clarification that so far the HSTS has not where the program data has been sort of stored or exists. We do have a few, in the 2019, we do have a few programs where we have their program data, but effectively the program data is collected by separate program areas, and the work has not yet been done to sort of include that as part of the HSTS yet, although I think that would be a very good step in the evolution of this process. So that's just to clarify. At the moment, the Stephen team, the standardized evaluation team, they're relying on the Centre for Health record linkage to actually link that program data onto the HSTS for their work specifically at the moment.
Thanks, Alex. So we're getting close to time. There are a few other questions which I think we can probably answer in the chat itself, and we can get back to people individually as well. But please contact FACSIAR, myself, or Hannah, Rama, or Alex for any further information. So I'd just really like to thank you all for this fantastic presentation, and thanks to all of the participants today. Please look out for an invitation to our next Lunch and Learn on the 30th of April, which is around supporting families with complex needs, findings from a new ANROS study. So thank you all so much, and we will see you next month.
Thanks, everyone.